Hi, my name is Grace Cantor, and this is my presentation on my internship at Milford Public Schools. So my name is Grace Cantor. I'm attending Thomas Jefferson University in the fall as a part of the 3+3 Doctor of Occupational Therapy program, and I'll be getting my Bachelor's in Science of Health Sciences. Some things about me: I like sports. I play softball, volleyball, and I do indoor track. And OT has been a part of me for a while, and that's why I really wanted to do this internship. Where did I intern? I interned at both Jonathan Law and Matthewson Elementary School. I was able to see both age levels, and it provided me with a lot of extra accommodations. My supervisor was Frances Dow. She's an OT in the building, both at Jonathan Law and Matthewson Elementary School. She's been doing this for a very long time. She's been through many different places of learning. She participates in the PGTA program, which is the postgraduate program, and from her I've learned a lot. She has a lot of knowledge, and it really carried through to me. It's my site experience. Why did I choose a site? So I got to choose between two sites, and this was very good for me, seeing there's a wide range of age levels between the high school level and elementary school level, and this brings in a lot of different behaviors and how you really communicate with the kids, and it gave me a big experience and a wide range of ages to work with. The different settings would just be like the rooms. We go to the rooms here. They have some self-contained classrooms, and they don't. Like, some kids can go into a full classroom by themselves, so it's a little bit different in that area. And then the different needs would be that in the elementary school, a lot of them work on typing, and most of them, from what I've learned in Matthewson, are on the autism spectrum, so that's different compared to other elementary schools. And then here at Jonathan Law, there's a wide range of needs. And then here are the messages, and basically between both of the schools, it's basically saying that they want their kids to be a big part of the social life and in their community, and they want to make them the best person they can be. And how this relates to the OT is we just want to make sure that they're the most prepared for the world when they leave the schools, and that'll just help them become a better community person. What did I expect? What I expected was to just shadow and not get a lot of help from her, or just to be like helping behind the scenes. So it would be bringing buckets or bins of their activities. I didn't really expect to be hands-on at all. It was basically like an immense shadowing program. The responsibilities I had were between observing and contact. So observing is what I did expect. I was able to sit in some of the sessions, and I just met the kids, but that wasn't a big part of it. Other things with observing were just learning what happens and how it helps the kids, which would be like the separation of their hand, for example, and just what activities work with things. And then with the contact, it was meeting the students, giving them cues, which would be basically running the session, but having her there with me. So it really gave me the opportunity to step into the role as an OT. Even though I don't know much, it really prepared me for the possibilities in college and my field work. My challenges would be, when I started completely, it would be giving the correct cues, knowing how to interact, and that's the behavior and communication. It was difficult at first because depending on their needs, they don't understand how to work with their supervisor or the OT, and it could be challenging because some of them wanted to leave the room, some of them just didn't want to do it, and you really have to push them without being too harsh because you need to know what's right for them and what's not. And things like that, communication and connection were very important to helping me. The communication, you have to communicate correctly and just make sure that they're understanding that it's a safe space and they can learn and work, and that really ties into the connection, where you have to make a connection with the students so they can trust you and understand that you're the right person and they can trust you to go through the process. The skills that I have were increased communication, problem-solving, patience, and the overall grasp. I really think communication was built up in the fact that I had to learn how to speak to the kids of all different age levels and of all different needs, and that really helped me. With the problem-solving, it was more like connecting what activities went with their needs and how it would make them feel better. For example, using tongs to get a certain grip instead of using your whole hand to clench like this, you're supposed to do a tri-grip, things like that, and it's just putting pieces together. Same with patience. Those kids that don't want to do it, you have to be nice with them. Some of them take too long, but the length doesn't really matter. You kind of just have to push them through and help them finish it. And then the overall grasp is just learning the basics. I feel like going into the field in the fall, I'll be really ready because I've learned so much, and I just get those skills that are basic for the job. For my future impact would be like the experience in OT. I know a lot now from this, which is really good. More knowledge than other peers and early field work would just push me in the future for when I'm looking for field work. It'll be a little bit easier for me, or maybe when I'm in those introductory classes, it'll be easier to learn. Pushing my resume and then the overall knowledge of the field, just when I'm applying for jobs, I'll have that advantage over other kids, which would help me just having that past knowledge and experience. My future plans in the fall, I'll be attending Thomas Jefferson. Hopefully I'll be starting the program in the introductory and then hoping I will get my first field work, things like that, just any of my clinicals, and I will be going to many different job sites, so hopefully when it comes to the school one, I'll be a lot more prepared. And then I hope to graduate and go right into a job, and they have multiple hospitals on campus, so I'm hoping that I could get a job there, maybe like the Gibson Children's Hospital. Questions? Yeah.
Can you give an example of maybe your most interesting day?
Yeah, it actually happened last week. It was a crazy day. It was like no one understood what they were doing. We were at Mathewson, and we brought kids in, and they just wouldn't listen, or they wouldn't want to like do their activity after multiple times of telling them, oh, just do it, it's okay, like you can get a check. They do checks for getting rewards, like computer, some of them like to go outside, and we would tell them to do it, and they would just run away or run out the room, and we have to go get them, so it's a little difficult. Some of them like to rip things off the walls, which is hard getting them down to the room, but I mean, in the end, you know that you have to have a bad day, and then other days are good, but sometimes it gets a little crazy.
What does OT stand for?
It's occupational therapy.
What was your favorite part of interning?
I think meeting all the kids. I made a lot of connections. They're all super sweet and nice, and I just like working with kids, so that made it like worthwhile.
What would you say is the most important thing you got out of it?
I think the most important thing was the experience. I learned from my supervisor, Ms. Stow, that most of the learning that you get in OT is from just being in the field and asking questions, and I think just having the overall grasp and like learning how to communicate with the kids was very important.
Did you like the high school grade kids better, or did you like working with the smaller kids better?
I think I like the elementary school better. Just they like to create that connection, even though they can be a little crazier. They're better with that, and they like think it's cooler to see someone that's older, and they like look up to you.
Thank you for that.
Hi, I'm Lauren, and this is my internship with Walgreens Pharmacy. My name is Lauren Davis, and I will be attending the University of Kentucky in the fall as a biology major on the pre-pharmacy track. So like Grace, it's a 3+3 program. So like I said, my internship site was at a Walgreens pharmacy, so it's within like an actual Walgreens site itself, and then it's like kind of in the back. My site supervisor was Sue Femmel. She graduated from the University of Connecticut with a BS in pharmacy. She's worked as a pharmacist with Walgreens for 30 years. So this is just, I included a slide on how like a day in the life of a pharmacy goes. So first the pharmacist gets a prescription sent over by the doctor, and then it gets, so Mrs. Femmel would like go and approve everything and make sure it matches with what the doctor said. and then it gets sent over to the pharmacy technicians, and so then they scan it. It comes out on like a little leaflet. They scan it on the computer, and then it says the medication that you need. And so then the tech will go and look in like this area with all the different pill bottles, and then they grab the correct one, and then they scan it, and then they count out the number. So like this one, they would need 60, so then they count out the 60 on this thing. So you like dump them out here, and then you count by fives, and then you close it, and then you dump it into the orange pill bottle. And then this prints out, and then you put it on the label on, and then you put it in the bin. So a red bin just indicates that it's like a normal, like the pharmacy can do it whenever. A yellow means it was coming from a refrigerator, so some medications have to come from the fridge, so then you kind of have to do them faster. And red is the one where it's a waiter, and then blue is a normal one. And so then it goes back to the pharmacist, and then they put it in the bag, and then it goes for someone to pick it up. So this is my site experience. So why I chose this? So I mainly chose this pharmacy experience because it's like retail pharmacy, which is pretty common, and it's the easiest way to get experience within pharmacy. So there's multiple different aspects of pharmacy, whether it be like in the hospital, or you could be compounding, but retail pharmacy would be the easiest for me to go in as a high school student and get like basic experience. It also, I chose it because it helps build your resume, because I was working with like an established company. This was their like mission statement. And then my prior expectations, so I expected it to be very heavy with face-to-face customer interaction, like people going, because I mean, like all of us have been to a Walgreens or a CVS and then picked up our medication, so like I figured it was going to be very heavy on that. Didn't think there was going to be a lot of computer work, and then mainly just filling prescriptions, like similar to how you would think a pharmacy works. So my responsibilities were helping with like vaccination paperwork. I helped helped fill and watch the techs fill the prescriptions. It was mainly just the behind the scenes stuff. It was mostly observing and watching, listening, and asking questions to further my understanding. So my main challenge was I'm not certified to do anything, so it was kind of hard for me to be able to, like, I can't fill prescriptions because I'm not technically a pharmacy technician, and I can't really go through, because you're dealing with real people's prescriptions, so it's like there's a risk with that, because like that's just something you have to be extremely qualified to do, which is why I had a fear of making a mistake that could negatively harm a patient. And also, so Mrs. Femmel works as a floater pharmacist, which means she's not necessarily at one site location. So we were bouncing around. We were in like Fairfield, New Haven, multiple sites at New Haven. We're at the Milford one, which is like right across the street one day. So at each pharmacy, the techs kind of run it different. So each site has its own like nuances, and it's just, each one has a different way they run it. So it was kind of hard to get a feel for it, but after you're there for an hour, you kind of like settle in. So in my conclusion, so the skills I learned were, I mainly learned how to become a pharmacy technician from this, because it was just, those were like the easier skills for me to work at my age, which would be consisting of like filling prescriptions, computer work, and then that's the people you talk to when you first go to the pharmacy. And then skills that will help me in pharmacy school are dealing with patients, being fast but thorough, and how to communicate with coworkers and like effectively run, because technically a pharmacist is the boss, so there's like some layers to that where you have to understand how to work with people and be a leader. And so for my future plans, this provided me with experience, which obviously is always beneficial when you're going into any future field, specifically within the medical field. So I have a greater understanding of pharmacy. This helps build your resume, obviously, as you're like reapplying to pharmacy school or even just getting a job in the future. and it will put me ahead in school because I will already understand how pharmacy works. Because I was talking to a lot of the different pharmacists there, and they said that a lot of people spend their time in school, so they go to school for 6 or 7 years, and then they get to a pharmacy, and then they realize that this is completely different than what they thought it was, so that was good for me to get my experience out now. And also just making connections, because it never hurts to talk to someone in your field, and yeah. So my immediate plans, so I will be attending the University of Kentucky starting in August as a biology major. In my first few years, I'll fulfill my prereqs, and then I can go to pharmacy school. I will probably work as a pharmacy technician starting next summer. And by the end of my years in Kentucky, I hope to graduate with a PharmD and then go and probably work in the hospital, I think, right now. I'll do retail after I have more experience, but I think I'll like the hospital lifestyle better. And yeah, that's it.
So I remember reading in your journals a little bit about your experience over at Yale, and you were just mentioning working in a hospital setting. Can you talk a little bit about how that felt different compared to being in the retail location?
So I did one day at Yale, but it was, so Yale and Walgreens are kind of connected, and it was like built into the bottom. So it's still technically retail pharmacy, but it was just a specialty pharmacy where you're just dealing with more intense medications because it was people from the hospitals. So it was more specialized. So like there was one day where we were dealing with, it's like chemotherapy, but patients can take it like at their house. So it was very, like it was an expensive medication, and it was just something you wouldn't see at like a normal, like again, down the street Walgreens. Like it's very, and there's more compounding that happens here, which you don't do in a normal pharmacy, which means you basically are making the medication, you just have like dry powder, and then you can make a pill.
What was your favorite part of your internship?
My favorite part was it's just like an engaging job. Like I found it to be, I thought it was going to be kind of monotonous, but it was very, like it was more engaging, and there was enough patient interaction to keep it interesting.
Now that you did this internship, are you more excited to go to school? Are you like...
I think I'm more excited because I didn't know if it was going to be more boring and like the same thing every day, but it's definitely like interesting, and there will be enough to keep me engaged.
What was the most exciting thing you did?
Probably the Yale one. I feel like that one was just like one of the medications was $25,000 for a month's prescription. So that was interesting to see them deal with. But and then they explained that like obviously no one can afford that. So then they have like grants, and your insurance covers part of it. But like that was the most interesting to me.
Thank you, Lauren.
Hi, I'm Katherine. This is my internship with the Milford Public Schools school psychologist. So I'm Katherine Folk. I'll be attending the University of South Carolina next fall, and I'm going to be a criminology major with a minor in psychology. So I interned at Harborside Middle School, and my site supervisor was Megan Viento. She's the school psychologist at Harborside. This was her first year in Milford Public Schools as a school psychologist, as last year she received her NCSP, which is the Nationally Certified School Psychologist credential, and she has a master's in school psychology from Southern Connecticut State University. My experience So I chose this site because I had some difficulty with finding a place to do a criminology internship because, like I can't really go into jails or prisons as a high school student. It also gave me some insight into different aspects of psychology that I wasn't really familiar with. And so, I knew some about education because I have some family members that are teachers, but this was a different aspect that I wasn't really, knowledgeable about. My prior expectations, I figured I would have a few interactions with students and participating in things like lunch groups and sitting in on some sessions. And I expected to file some paperwork, but I mostly expected to be shadowing, and I didn't really know, what else I was going to be able to do. So my responsibilities, I was mainly observing. I sat in on a few sessions, and then we would debrief at the end over what the student had and why they were coming in and what their course of action was. I also filed some paperwork. I did some student observations in classrooms, and I also did some scoring of emotional tests in preparation for PPTs. And then I also read some case files and discussed what type of treatment I thought, and then she would discuss what she was actually doing and why that was what her path she chose was. And then I also was used to give insight to rising freshmen next year, some kids that were nervous about going into high school. I was used as a form of support and tell them what actually high school was like instead of just coming from a teacher. Some of the challenges I had was my age, because I'm kind of close in age to the middle schoolers, and some of them weren't really comfortable with someone so close to their age knowing all about their personal life. Also confidentiality. There's psychologist-student confidentiality, which means I can know a lot of stuff, and I also wasn't certified, so there wasn't a lot that I could really do and a lot that I could know because I wasn't certified as a school psychologist. Conclusion, so some of the skills I learned, I got better insight as to how to deal with certain psychological situations, what paths you would choose to take when students are having a bad reaction to something, if they're getting angry at something. I also have learned the ability to recognize different coping skills, which coping skill should be used for a different situation. I also learned how to score emotional tests and how to use those results to determine what the next step should be, especially in terms of PPTs and IEPs. And I also learned how to write a case report and read one, because the language used in them is very different from what I've seen. And then future plans, obviously it gave me experience, and it gave me a greater understanding of psychological processes in children, which are different from those in adults. Making connections, and it's a different kind of experience that'll set me apart from other criminology students. And then my immediate plans, I will attend the University of South Carolina starting in August as a criminology major with a minor in psychology. I'll immerse myself in the campus, possibly joining the psychology club, academic sororities, etc. And I plan on fulfilling all of my credits in 7 semesters and graduating early, and then jump-starting my career into the field of criminal psychology. Any questions?
I would love to know about a typical day, and if there was a typical day for you.
There wasn't really a typical day because, again, with the, what I could do, some stuff, because, I can't really sit down on, PPTs, but I can, learn about, IEP plannings and things like that. But it would all just honestly just depend. And, when I wasn't able to sit down in on stuff, I would go to room 15, which is the life skills room. And that's where kids with different levels of autism, learned. And I would get sent there and I would observe, all the skills they were learning that day and, what they were doing. I sat in on a couple of student sessions. Sometimes the kids weren't comfortable with me being there, which I totally get, because I'm 4 years older than them at the least. I also did, again, I filed paperwork and stuff, their files for next year, what school they were going to and stuff like that. I sat in on a couple lunch groups with groups of, there was one with 6th grade girls and stuff like that, but there wasn't really a typical day. It varied depending on the day. Shelby?
So since we took AP Psychology, did you notice any overlapping or anything you learned helped you?
When I read she gave me a big 30-page case study for me to read, and I read it and I understood most of it, but there was a lot of the vocab we learned, a lot of the languages in there, and that helped me understand it, because it was when I first looked at it, it looked like gibberish, but then once I started reading it, I was okay, I understand some of it. Grace?
Can you expand on the student observations and what you did when you went into the classroom?
So for student observations, like I'm just gonna use one in particular I did for example. So it was for a girl in 6th grade with ADHD, and it was to like evaluate what her IEP was gonna be for next year. So I had to count, it was like every 10 seconds I had to check whether or not she was on task, and if she was on task, like I would give a check, and if she wasn't on task, I would give an X, and then you would look at the end how many checks and how many X's you had. And then there was another one where I observed in a math class, and there were 2 students, and one of them like always got out of his seat. So every time he got out of his seat, I would check, and the other one, whenever he fell asleep, I would have to give a check, and then I would give like the results at the end, because a lot of times when there's like a teacher in there, they'll like behave better because they know that someone's watching them. So they hope that if they sent me in, that they would like not, they would like just act normal. But yeah.
I have another question. So what do you think is the most valuable piece of advice that your supervisor gave you, or like a skill set you feel like you're walking away with? What do you think is the most valuable out of this experience?
I feel like the skill set that was most valuable was definitely like learning how to deal with different situations, because every student's different and they all react to different things in different ways. And like I saw like the same couple students like on repeat, and so like I would like know like what her course of action was going to be, because every time it would be different, and like it's not like every student's different. So there was like, for example, like some students with autism that react like, there was one that reacted angrily when there was a change in routine, and one of the days we had to cut the session short, and so like I knew how Miss Viento was going to handle that situation based on like the amount of times I've seen her before. So yeah.
Most interesting interaction.
I would say probably my time in the life skills room with the kids, because it's like, obviously autism is a spectrum, and every student like had a different level of like, every student had a different level of autism. So like they would all have different like activities they were doing, and like different ways that their paras would help them, which I thought was really interesting. And especially because like that would be times I get sent out of the room, but I think that would be honestly more, it's like very interesting to me.
I'm Jenna, and I did my internship at the Physical Therapy and Sports Medicine Center. So I'm Jenna Wasserman. I'll be attending the University of Delaware in the fall as an exercise science major on a pre-physical therapy track. So I entered at the Physical Therapy and Sports Medicine Center in Shelton, and there's various locations throughout Connecticut. So this is the inside of the facility. It's new. It's been open for almost a year now. My site supervisor was Nicholas Almonte. He's the partner and director at Physical Therapy Sports Medicine Center of Shelton, and he teaches classes at Sacred Heart University teaching physical therapy students. So I chose this site because physical therapy has been an interest of mine since middle school. It's always been something I've been interested in going into. So doing my internship at a physical therapy clinic would help me determine if it's actually what I want to do before I go into 6.5 years of school and then realizing I didn't want to do it. And it also would provide me with great experience to help me with classes when I start. So the mission of Physical Therapy and Sports Medicine Center is really just to help their patients get back to their daily lives, doing what they did before they ended up in physical therapy. But they also care about making good relationships with you and getting to know you. So my expectations prior to starting were just to be shadowing the physical therapist, watching what they were doing, and just asking questions. As well, I knew I couldn't do too much, but help out in any way that I could. My responsibilities, so like patient contact, I would bring patients ice and heat packs. And as I went on, I learned with it, because there were different size ice packs and stuff, so I learned when they were used for, so they didn't have to tell me. I brought equipment to patients, and I would talk to patients. A lot of the patients love to get to know you, and they willing to tell you about their cases as well. And so they would let me ask questions, and they love to have conversations. And I sometimes even told patients their next exercises, and sometimes even demonstrated the exercises for them if they didn't know what to do. And sometimes I would count the reps for patients, because sometimes patients would like to talk as they were doing it, so I would count for them so they didn't lose track. I would wipe down tables, clean rooms and organize them, put equipment away, and I would even try some of the exercises that patients did on my own. And doing this helped me understand exactly what the exercises help with. I mainly did observing, following around the physical therapist as they moved from patient to patient, asking them many questions. I learned a lot as I observed many different injuries and how to treat these different injuries. And I even watched dry needling and cupping, which was pretty cool. So I observed a variety of different injuries and how they were treated. So even injuries for the same body part were treated differently, which was cool to watch. I got to know lots of patients. They would talk to me about their cases. They would ask me questions and just have nice conversations with them. I observed a lot of the same patients over the few weeks, so I was able to see their progress and how physical therapy had helped them. Because many of the patients, since I first started and now, have been using heavier ankle weights or free weights or bands with more tension, or their exercises got harder, which was cool to see how much physical therapy can help them in just a couple weeks. I learned that the mobility of your injury needs to be worked on before you work on strengthening, which definitely helped my understanding much better of physical therapy. I also learned more about the anatomy of the body and how different parts of the body work together. So some patients with lower back pain, you need to work on hip stability because those two work together. Same with knee injuries and strengthening your hamstrings and quads. I observed exercises on how to retrain muscles, which was cool. For a shoulder injury, someone would put a band, step on a band and bring it around their shoulder, and would do movements like that to train the muscle to move correctly again. I observed dry needling and cupping. So this is dry needling, and dry needling stimulates a twitch response in the muscle fibers, which helps to relax the muscle and promote healing. And cupping increases blood flow to the sore areas of the muscle, which helps with pain relief and healing. And this experience had helped me realize that physical therapy is something that I want to go into. So some of my challenges was just, since I'm not certified or have not gone to school yet, not always knowing what I can and can't do. So I think my time management definitely improved as I had to show up on time and make sure I get in all my hours around sports and school activities. Communication skills by asking physical therapist questions and listening to them, as well as the patients, starting conversations with patients and just talking to them. And I learned lots of different exercises and stretches for different injuries, which I think will definitely help me when I go on for labs in school, because I'll already have some prior knowledge to that. So this is some of the different equipment that was used. So this is the facility, and there's bikes and leg press, which are mainly used for patients with knee injuries to help strengthen that. These two on the top are for balancing and stability. And these are bands, and usually the darker the band, the more tension. So as they progress, they'll use darker bands. And a lot of the patients use ankle weights for leg injuries to strengthen their hamstrings, and free weights for shoulder and arm injuries. And this is a fibroblaster, which helps to decrease dysfunction in the tissues to help improve mobility and decrease pain. And that's a slant board for the knee, which I learned is the most important thing when any knee injury, no matter how severe or not severe it is, because knee extension is the most important thing that needs to be worked on. Otherwise, your legs won't work properly. So this internship will be very helpful for me in the future because it gave me lots of great experience in this field, which giving me lots of prior knowledge before I start, which could put me ahead of other students. I made lots of good connections and just definitely learned lots of different skills and information that I will benefit from once I start school. So my future plans, I'll be attending the University of Delaware in the fall, and I'll be a part of the College of Health Sciences and be doing prerequisites my 4 years of undergrad for Doctor of Physical Therapy school. And then I plan to, once I graduate from graduate school, I would like to work in a children's hospital for physical therapy. Any questions? Yep.
Why would you want to work at a children's hospital compared to like the place you worked at before? Oh, well, you did your internship.
Yeah. Well, I liked where I did my internship. It was nice because there's like a variety of different patients, but I feel like more of an inpatient thing would be better for me, and I love working with children, so I feel like it would be cool to do that for at least some time. Grace?
Do you have an example of like a similar injury but like 2 different techniques to help it?
Yeah, so there was like, for like shoulder, there was someone who like had like a shoulder surgery because they like tore something, and then just people who had like a frozen shoulder. So the person who had the surgery couldn't do as many like different things. They had to work on getting their mobility back first, while the other was working on strengthening.
What was the most interesting exercise you saw?
I think definitely, well, there's a patient with Parkinson's, which I didn't even know you could go to physical therapy for that. So for that, they had to work on like balance. So they would, on like this like half yoga ball, they would like stand on that, and I'd like throw like a ball while the physical therapist would like move them around to work on their balance, and I thought that was pretty cool.
Hi, my name is Shelby Green, and I did my internship with Miss Aronin at Matheson Elementary School, and this is in the Milford Public Schools District. So, like I said before, my name is Shelby Green. I'm a senior at Jonathan Law. I will be attending Southern Connecticut State University. I will be majoring in elementary education, and after that I plan on becoming an elementary school teacher. And then some interests about me, I like playing sports, and I like working with little kids. So where did I do my internship? I did my internship at Matheson Elementary School. Who was my site supervisor? So my site supervisor was Miss Aronin. She is a reading and writing specialist, and she was a classroom teacher before transitioning. And so what her job is called now is an instructional coach. So there's many different types of instructional coaches, but the one that type she is, she focuses on reading and writing. There's also math and there's science instructional coaches. And she attended Marist College and got a degree in psychology, and then she went to Southern and got her teacher certification, master's, and 6th year. So something really important that I think I learned was that she got her psychology degree, but she told me that was like one of the most important things she got, because learning how like kids think is like really important, especially when you're working with like little kids, because they think differently than us. They're more creative and they have like free range, so you have to understand how they think in order to like be able to like come across them and teach them. How it works, so I'm just going to explain like what an instructional coach means. So she focuses on reading and writing, and so throughout the day we take kids out of the classroom and we focus on teaching them how to read and like write, and specialize in like vowel sounds and stuff like that. And it's really important because reading and writing kind of sets you up for like your future, because if you can't read, you can't read your math problem in math class. If you don't really understand how to write numbers or write letters, it's going to be really difficult to succeed in all the other subjects. And so this is my site experience. So this is also just explain why I chose Matheson Elementary School. So I actually attended Matheson Elementary School, and I wanted the experience of real life teaching in different situations. And I also wanted to make sure that teaching was like the right gig for me, because I have a lot of teachers in my family, but
my family's either teaching or nursing, so I kind of wanted to follow that, and I like the idea of teaching. And my mom talks so wellly about Matheson and like really loves her job, so I kind of wanted to experience that, and so that's why I choose Matheson. So this is our site vision. I'm not going to read it all, but that's the principal, Miss Courier. She's amazing, and she really wants to focus on like kindness and bringing kids and making kids enjoy coming to school. And she made this program called the PAW program, and it's designed to help teach and reinforce positive character traits. So not only does she want to let kids succeed in the classroom, she really wants to make sure that they're all well-rounded kids. And then the purpose, she also, every year she picks something new to focus on, and this year she picked dreaming big. She wants kids to strive for greatness, and she wants them to be happy and like confident in coming to school, and not only will they excel in the classroom, they'll excel in the real life situations. So prior expectations, well, I always expected that obviously I was going to have to be a good example for the kids, be respectful and responsible, and I have to encourage the kids and like positive reinforcement to allowing them to learn, and also not to give answers, because like in school now you can't give answers to kids. You want them to figure it out for themselves while providing support. So my responsibilities. So I had responsibilities of shadowing Mr. Ronan, and I was actually able to like teach the kids, and I had the responsibility to be like positive reinforcement and encourage them to do stuff and keep kids on task. Along with like I actually helped to do some like reading tests. Like there's a test called the Dibbles test, which like kids read for a minute, and I actually was able to do that. And I was another teacher in a room, so they could ask me questions, and kids really liked having another teacher because when there's only one in the classroom, it's hard to get your point across. Some of the challenges that I struggled with was like kind of like the fear of messing up in front of the children or like saying something wrong, because you don't want to like be a bad influence or whatever. And also, while going there my first day, I was kind of afraid I wasn't going to be respected like all the other teachers, because although I'm not like that close in age with them, I'm still younger than all the other teachers there, and I wanted to just be respected. And also, I was given the task to teach a lesson on my own, and I was kind of nervous to do that the first day. Although like I knew the information and was very confident in it, I was just nervous that I would say something wrong or something like that. So, conclusion of the skills that I learned, I had experience in the classroom, experience with the reading and writing specialist, which I thought was like one of the coolest things, because I could have done it with like a classroom teacher, but I really enjoyed that I was able to go to grades like, so we mostly focus on like 2nd, 3rd, and 4th grade. We don't really do that much with 5th graders, but it was really, in kindergarten, we work with kindergarten. It was really amazing to see like the differences between how well the 1st graders can read compared to like the kindergartners, or like the vowel sounds that they focus on and being able to do that stuff. I also learned how to communicate with teachers, because mostly you want to keep like all the same grade levels on like the same topics. So in like 1st grade, they're working on realistic fiction. So you want like all the 1st grade teachers to be on the same path, pretty much do the same plan, so they're all getting the same education. I also learned how to lesson plan. So Mr. Ronan gave me really good advice that you don't want to plan too far ahead, because if you plan too far ahead and like one day there's something that comes in the way of like getting the lesson plan done, you're going to be messed up. But if you plan like one day and then you ask them questions in class and you like continue on with that and see how far they get, then you can plan the next day, and that way you'll be like prepared. I also had the opportunity to see the curriculum in elementary schools, so I actually got to like sit down and read it and see what they're expected to teach the kids. And then I got to have hands-on experience teaching kids, which I thought was really cool. I was able to take like many groups of kids and read with them, and I was able to teach them, like, we used flashcards to learn that their vowel sounds, and they would put the picture and they would say the word out loud, and then they would put the picture like with the vowel sounds next to it. So this helped me with my future plans. So it provided me with classroom experience. It gave me a greater understanding of what is expected to become a teacher. And I also made lots of connections with teachers. I was able to talk to like all the different grade levels, and I really enjoyed that part. And it also has the ability to add to my resume. So plans ahead. I will be attending Southern Connecticut in the fall and be majoring in elementary education. Miss Aronin really inspired me to minor in something like special education or reading specification, because that allows you to like get more job opportunities. And if I like have that degree, then I can become like what she is, an instructional coach. So by the time I graduate Southern, I hopefully will be in a great position to obtain my first teaching job. Any questions? Catherine?
Did interning with a reading specialist instead of a regular teacher give you insight as to what you want to do in the future?
I would say yes, it did, because I want to get like some experience in the classroom first, but then I would really be interested in being like an instructional coach like she was, because I really liked how like you would
break kids up in small pairs, and like kids who struggle with reading don't really want to be put on the spot. I learned that. Like, so when they're with like a small group of people, they really like enjoy actually trying to read and like sounding out the words. But when they're like in class and they see all the other like fellow classmates just reading, they kind of get like nervous and like anxious, so they don't really like to read in front of other people. But when you break them up into the small groups, they really enjoy reading, so I like that part of it. So yeah, I would be interested in specializing in reading.
Would you have rather do reading or math for kids?
Personally, I would rather do reading because I feel like there's more creativity in it, and then also reading and writing like pair together. So like I really like how like the kids love writing stories. Like that's one of their favorite parts of the day. Like now for like us in high school, writing doesn't seem that fun. But when you're in elementary school, like they love writing about their favorite characters or anything that like stuff like that. So I like that. I mean, math is also very interesting. I got to watch a math lesson be taught, and it's cool like how they're teaching math now because it's way different than when we were in elementary school. But
Did you have a particular student or experience that maybe was like inspiring to you?
yes, so there's one student that I worked very closely with, and she gets taken out of the classroom like every day. And she actually came to Mathewson last year, and she did not speak much English at all. And now she's reading at a baseline level of reading for kindergartens, which is amazing. And like she didn't really have many vocab words. Like she wasn't really experienced in like we had a picture of a bus. She didn't really know what a bus was. She gets driven to school every day, so she doesn't see that. There was a picture of a leaf. She didn't know what a leaf was. And with that, we had to like work very closely with her, but now she can read on the baseline for kindergartens, which is amazing. And it's really cool how fast they pick up.